It's really cool. The cells sort of shrink down as you sleep. So there's more space for the brain to drain the toxins. It's really cool. So you have to sleep. You have to move your body, sweat. Sweat will cause you to get rid of toxins, move the lymph, move the body. Okay. And then don't be a stress ball, because if you're someone who's constantly worrying, actively worrying about things, you'll shut your detox down, because detox isn't the behavior you do when you're running from the lion. It's the behavior you do when you've survived the lion. Okay. When you're in fight, flight, or freeze, or your fear, you're going to focus on survival. Survival is not a detox behavior. Okay. So detox is really what you do when your body starts to feel like it's thriving.
Welcome to the PEMF Effect, where breakthrough science helps take control of your health. I'm Dr. Wendie Trubow, and I'm here to guide you in tapping into the power of PEMF therapy for recovery, vitality, and total body wellness. From overcoming chronic pain, optimizing brain health, boosting energy, and aging with strength, this podcast is your path to cutting-edge solutions for lifelong well-being. If you're ready to move beyond symptom management and tap into your body's natural healing ability, you're in the right place. Let's dive in. Today's episode was previously recorded on the Pain Solutions Summit that I hosted.
Hello. How are you, Dr. Trubow?
So great to be here, Marlene. Call me Wendie.
Wendie, thank you so much, Wendie, for doing this. This is such a great topic. It really is. This is so needed. Before we get started, why don't you tell us a little bit about yourself?
Sure. My name's Dr. Wendie Trubow. I am a board-certified OBGYN, and I also have my MD from Tufts, and I also have my MBA from Tufts. Graduated in 2000. So I realized I've been in practice for over 20 years, which is crazy. And I still love what I do. So I have a functional medicine practice in Newton, Massachusetts with my husband. It's called 5 Journeys, and we just came out with a book on toxins called Dirty Girl, Ditch the Toxins, Look Great, and Feel Freaking Amazing. And that's what we're going to talk about, right? Toxins.
I just love it. And I love the title. I love the title because it is catching. I see it back there. It was the first thing that caught my eye.
Nobody forgets the title. Nobody's like, what's the name of the book?
Right.
Dirty Girl, right.
Great title. So how did you get into this toxin, the toxin Dirty Girl? How did you really get into all of this?
Well, I was talking to someone earlier, and we've decided that essentially I am my own muse. So because the next book is going to be all about how not to be a hot, crazy witch as you transition into menopause, as I'm doing right now. So more on that another time. So I had all these toxins, and I was losing my hair and gained a bunch of weight and had a rash, and I wasn't myself. And I mean, I was already in functional medicine, so I had already been doing everything right around diet, no alcohol, no sugar, and taking all my supplements and blah, 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 and exercising. So in theory, I should have been $1 million, except I was a hot freaking mess. And so I started to dive into what's going on and found that I was essentially the repository for all toxins, leave no toxins left uncovered. So both lead and mercury, 4 strains of mycotoxins, a whole host of environmental other, so plastics, gasoline fumes, nail polish. That was the first to go. Unfortunately, no more done nails. And I didn't have glyphosate. That was like the one thing that I was so proud of, because I don't eat a lot of grains. And so I had no glyphosate, which was great, but I had pretty much everything else. And I went to my husband, I'm such a dirty girl. And then I went, oh, wait, if I'm really such a poster child for healthy living, and yet I have this, what does everyone else have? We need to get the word out. Hence the book.
That is interesting. So tell us a little bit about environmental toxin and how it affects our health.
Okay, brace yourself, they're everywhere, and they make you sick. So having said that, there is hope. The goal is not perfection. The goal is improvement, leveling up. So for example, environmental toxins, I mean, they really are everywhere. So you walk into your house and you're like, oh, I love that fresh, clean smell of my floors having been washed. Right, those are toxins, and they're not in your favor. Or you go and, sniffing, huffing, all of those things, those are all toxins that will impact your brain function, put you at risk for cardiac issues. MTBE is an additive that goes into gasoline fumes. And I was quite high in this, which is why I always talk about it, because mine was really high. And I said to my husband, we live in Massachusetts. So remember, it's cold here half the year. And I'm not a huge fan of cold. So I said to him, I'm not pumping my gas anymore. And he's like, you just don't like the cold. I'm like, no, I have high levels of MTBE and it's an endocrine disruptor. And I don't really want to be exposed to that and the potential cancer causing agent. So we're done. So for things like that, it's really everywhere. It's all throughout. And so the goal is, how do you identify those little areas of exposure and start to eliminate them, systematically?
Right. So what would you say is the biggest misunderstanding about toxins?
The one biggest misunderstanding, I would say, I of course, so I'm Jewish and we argue with ourselves, right? We're like invented debate, basically. So on one hand, I will say one of the biggest misunderstandings is that it's possible to get rid of all of them, because it's not. They really, if we're living in this world, they're pretty much everywhere. I mean, we're all addicted to our cell phones, EMFs. It's everywhere. The EMFs are toxins for some people. And so that's one huge misunderstanding. And then I think the other one is that, no, I think I'm going to stick with that one. That's my favorite, that it's possible to be perfect. It's not.
So other than the EMF, what would you say is the most common types of toxins?
Are you tired of living with chronic pain? Medication only masks the symptoms, but real healing starts at the cellular level. I'm Dr. William Pollack, the leading expert on PEMF therapy. Pulsed electromagnetic field therapy is a science-backed, drug-free solution that helps reduce pain, speed up recovery, and improve overall health, right from the comfort of your home. Take advantage of an exclusive 10% discount on drpollack.com PEMF systems. Visit drpollack.com, that's drpawluk.com, to register and claim your savings. This limited time offer is available only to registered listeners. Don't miss your chance to experience the benefits. Terms and conditions do apply. Don't just manage pain, transform your health. Visit drpollack.com today and let's get started on your healing journey together.
Yeah, so I think you have to categorize it. So within the metals, there's cadmium, lead, and mercury. Within the mycotoxins, which are the toxins that mold strains put out when they're in your body, that's usually ochratoxin, gliotoxin, aflatoxin, zearalenone. Those are the most common ones we see. And then the environmental toxins, or the other, because I guess you think about it, lead, the metals and the mycotoxins are truly environmental also, but the other category is all of our beauty products, what we paint our houses with, the stains we're using for the floors. And we did our chicken coop and I insisted on using a non-toxic stain. And my husband's like, well, it's outside. What does it matter? I said, A, you're still doing it. And B, our chickens are going to live there and they're making us eggs. So I don't really want to eat eggs from chickens that are toxic either. So any of the stains and the VOCs and the paints, if you're doing construction on an old building, you're getting likely exposed to lead as you dust. There's the lead gets dusted from the paint that was used up till 1976. So it just starts to snowball. If you take your clothes to the dry cleaner, you're getting exposed to chemicals that you then put on your body. If you wear clothes after buying them and don't wash them, there's chemicals to preserve it as it gets shipped from other countries so that so the animals don't eat the clothing essentially, or moths don't get to it. Okay, that's not in our favor. If you sleep in a bed that is not an organic bed, you're getting exposed to flame retardants, which are a tremendous thyroid disruptor. People usually stop me at this point because they're like, okay, I got it. It's terrible. But there is hope. It's fixable. There's hope. And it takes some mindfulness and proper attention.
So then, okay, so if we can actually fix this, what are some of the ways that we can actually assess our risk exposure and also test some tests that we can actually do that can actually tell us what we have?
Okay. So nobody likes when I answer this. Okay. So when someone says to me, I've there's kind of a couple categories. Either you've really done everything and you lead a great life, and yet you still don't feel great, or you can't lose that weight, or your hair is falling out, or there's some complaint, right? You're like, I'm doing everything right and I'm still not so good. That deserves a toxins eval. And if you are someone who's then on the other side of it, super sick, and this is that, 1 to 5% of people, for example, the people who come in and the woman has lost all the hair on her body. That's, I would say, the end result of being super sick. Those are the people who really need a toxins evaluation, or have tremendous body load of autoimmune disease. Even one disease is suspicious, but if you have multiple autoimmune diseases or Alzheimer's, Parkinson's, some type of degenerative disease, those are, I would say, the 3 buckets of people I would recommend head right for a toxins evaluation. And it's pretty easy to do. It's not cheap, but it's easy. Okay. So they're all urine tests. The metals testing is a 2-part test, all urine, and we use a provoking agent to pull out the metals. And I say to people, you're either going to feel amazing when you do that test. That means you got metals. Or you're going to feel terrible when you do that test. That means you've got metals. If you don't notice anything, we're not sure until we get the result. We'll tell you when we have it. But 2 out of the 3, you have an early response, And then there's the mycotoxins, the other environmental toxins, herbicides, pesticides, insecticides, glyphosate. That's the separate category. That's also a urine test. You take glutathione for a week, do a hot bath, do the test. Not cheap, but easy.
Wow. So it is easy, actually.
It's super easy. You just pee. You pee every day anyway. So
right. So when you might as well. Because I know for a long time it was usually a hair sample.
Yeah, you can. I'm not a huge fan of hair samples because it shows what your body's naturally moving, but it doesn't show what you're storing. What you want to get at is what you're storing. That's the problem.
Plus, women, we have hair dye. So we can't ask any woman to go without hair dye for 3 months to be able to do this, to do a hair sample test. And we cave. I cave after a month.
So you have to be honest with you. I don't dye my hair. And I did say to my husband, if you really feel strongly that you have a wife who has hair that is not white, you need to get another wife. Now, it's another source of toxins, by the way, to be a bad news bear. But there is a company in London called Overtone that is a more natural dye. You do it at home. Anything you're going to get in the salon is most likely highly chemical. Really, I mean, hairdressers, glass blowers, shipbuilders are like the 3 groups of people who are often very toxic because what they're exposed to in their daily life. So I always say to a woman, like, why would you dye your hair? You're beautiful. Those hairs are a badge of honor. Those white hairs, you earned them. As a female in this world, you earned them. Celebrate them. Mine are also like thicker and curlier than the rest of my hair. So I'm like, it gives you some bounce.
Right. And then you're kind of toxin free.
Yeah, but I would say if possible, I mean, the grow out, I know there are people who actually specialize in helping women grow out their hair from dye. There are hairdressers who do that. They'll match the color that you have. But if it's possible, I would say, yeah, don't dye your hair.
All right.
If possible.
Okay. The next time you talk to me, I will be a full head of hair. Right.
And to be beautiful just as you are. You're beautiful either way. Just like be fully you, right?
Just so much fun. So what is the link between persistent disease, maybe chronic things, and environmental toxins?
Yeah, I mean, there's a ton of environmental toxins, right? So anything can make you sick. And I think we referenced EMFs. I've had patients who I say I can never remember the name of this telescope, but there's a telescope, I think in the Virginia area, maybe not Virginia, somewhere on the East Coast, mid-South, and it has a 10-mile radius where there's no towers, there's no cells, there's no nothing. It's a dead zone in terms of EMFs. And I say to people, maybe you should go on vacation there to see if EMFs are messing with you because you've done everything else right and you seem really sensitive. So maybe it's EMF. So that's an environmental pollutant. And then the link between environmental and chronic illness is, think of it as these are things that the body can deal with in small amounts. Okay. Think of it like toddlers. You could deal maybe with 1 toddler, but if you have a whole room of 20 toddlers and you're on your own, you might not be the highest functioning human being if you have a whole bunch of, so that's a terrible example potentially, but these toxins can be difficult for your body to deal with. And if you're exposed to them ongoingly and it's cumulative and you haven't gotten rid of what you had the other day and now you're piling more on, it's very difficult for the body to recover. And so what happens is the body shows signs. The body acts out, right? It's like a hungry, tired toddler. It acts out and you get symptoms. So that's either weight gain, fatigue, brain fog, autoimmune disease, cancer, degenerative disease. The body starts to represent its upset in what we'll call a diagnosis: migraines, asthma, anxiety. I have celiac, bloating, gas, diarrhea, constipation, fertility issues, whatever you want to say is your issue. If you've done everything right and you're still not really great, it hasn't gone away, then toxins are a concern.
So you mentioned EMF, which is cell phone. We have them all day long. Some people sleep with their cell phone. So EMF goes into your body and it does damage, but PEMF, which is pulse electromagnetic field, actually goes in and it repairs the damage. So
no, it's amazing.
It is absolutely an incredible thing that you can have a device in your house, and instead of sleeping with your cell phone, you can sleep with your PMF.
I mean, do you have? I know you have the super expensive one in your office. Do you have one at your house that you sleep on, or that you sit on during the day? I'm like, I want one of those.
I know. We need to get Ed on board. He's got Dr. Pollack's new book, so he's going to be an expert. So I do have a full body system at the house, high intensity full body, and the one at the office is the same. So it depends on different conditions. The high intensity is probably best, especially for toxins. High intensity is best, and a full body system is best because you are able to treat your entire body in a treatment session. As you said, we have toxins everywhere.
Yep.
So
this is great. So like jealous.
And actually, if you go to drpollack.com, there's tons, and there's actually articles on different toxin, different disease process, because the toxins, that would be sort of the next question. What are some of the common disease process that you have seen from long-term environmental toxins?
Yeah. I mean, let me count. How long do we have, by the way? So it really comes down into, if you have autoimmune disease of any type, then that's very concerning for toxins. Hair loss is very concerning for toxins. Cancer is very concerning for toxins. And I would say pretty much any type of cancer, because think about it, your MTHFR pathway, which is the methylation pathway, is also critical for getting rid of toxins. The reason it's important to methylate is because take hormones, for example. You're taking your estrogen, and in order to make it water soluble and get it to leave your body, you put a methyl group on it. Think of it like a barbell. That's how I think of it. And you put it in the gut so you can poop it out. But if you're impaired at methylation, then your toxic estrogen form is hanging out. And your body's like, whoa, I can't deal with you right now. It requires a phase 2 methylation. And you then, in the meantime, put that in your fat to store it because you can't deal with it. Now these women say, I can't lose any weight. I don't need anything. I exercise all the time. I can't lose any weight. I'm like, oh, you got toxins. Unless you're perimenopausal, in which case you might have perimenopause. But that's a separate issue. So as long as you peeled away all the issues, anything that people have that's persistent is concerning for toxins. Degenerative diseases, Alzheimer's, one form of Alzheimer's is linked to toxins. There's a number of different ways that can lead to dementia and degenerative disease, and toxins is a huge category. So it really is kind of, anything you say to me, I would say yes.
So you kind of touched on cancer, and this is really such a big deal. When we do consults, people call into drpollack.com to get advice on a PMF device. We get a lot of cancer people. So talk a little bit about cancer and the link to environmental toxin and tumors.
Yeah, so there's a lot of environmental toxins. So there's thinking back from cancer and there's thinking forward from the toxins. So there are a number of environmental toxins that according to the World Health Organization, different big governing bodies are clearly linked with tumors and cancer. So for example, glyphosate, which is the most commonly used herbicide in the world, people know it as Roundup in their yard. It's associated with a number of different tumors. And so you can go sort of A to B. You're not allowed to say it causes it, but you can say it's associated with. And so there's like a wide range of these toxins that are associated with plastics associated with cancer. And these, a lot of the names I'm not using because you'd be like, well, I don't know what that is. No, nothing is listed as NAE or NAHD. It's not listed like that. Okay. So when you look at the downstream, the products it's in, plastics, styrene, volatile organic chemicals, paints, potentially, all of these things can track backwards. And so it kind of it's not causal, it's related.
It's related.
Suggestive.
Right. Associated.
Yes.
So now we kind of talked a little bit about the environmental toxin and some of the symptoms and different kinds of environmental toxin. What about treatment? Because now we know we have it, we know how to find it. Tell me a little bit about treatment and actually nutrition and supplements.
Okay, Marlene. So this is a huge question. And the first thing is perfection's not the goal. The goal is just leveling up, getting better. So let's think of it in two ways. One, try not to fill up your body with toxins, meaning as you're running out of your beauty product, go to ewg.org, get a better product, get something that's better for you. My favorite beauty brand is Beauty Counter because there's like a whole list of like 1,200 things they refuse to use, which is great. And they're committed to better beauty. It may not be perfect, but it's better beauty. It's EWG certified. So as you're starting to run out of things, level up. As you run out of your cleaning supply in your house, look on ewg.org and say, is it the best or should I level up? What about your laundry detergent? Level up. These are things right next to your skin. Your skin is a huge organ. It's the largest one, and it's a very good organ to absorb things. So make sure your lotion is clean. Make sure your clothing doesn't have chemicals in it. How about your dishwashing detergent? Anything that you're using, your pans. By the way, we have a free gift for the listeners because this can feel a little bit overwhelming. And so I'm pretty sure we gave you that, and we'll get you that link if not, so that they can have the guide to detoxing their life. Because here, you look at it, you go, oh my God, there's everything I need to work on. Yes.
Right. Yes. I was just going to ask that because I was like, and sitting and I'm like, okay,
I know I see you freaking out over there. I'm like, okay.
Because I gotta check my pee and see yes. What's in it, and then what do I do and throw out all of my stuff in the house and where do I get the information? So yes, I've got
yes, 5journeys.com/promo. It's a free guide to detoxing your life. It's actually not free. We sell it, but for the podcast and summit people, they get it for free. So anyway, I've totally lost my train of thought here. Can we go back because I've gotten completely distracted?
Yeah. We were talking about what kind of steps people would take because we were talking about supplements and we were talking about things that people. Yeah.
Thank you.
Your body was designed to heal, but illness, chronic disease, stress, injury, and time can slow that process down. What if you could restore your body's natural ability to recover, recharge, and feel its best? The key to healing is giving your body the energy to repair itself. PEMF therapy does exactly that. Recharging your cells, improving circulation, reducing inflammation, and helping you function at your best. For decades, I've studied this technology, worked with hundreds of medical professionals, and helped thousands of people reduce pain, regain energy, and take control of their health. However, not all PEMF devices are created equal. No one size fits all. We offer personalized consultations so you can find the right device for your needs, backed by real science and trusted results. If you're ready for a real solution, let's talk. Schedule a consultation at drpawluk.com. That's drpawluk.com, because real healing starts at the cellular level.
So don't fill the pump. Level up on as many products as you can. I do think testing is really important because I would not have known to stop pumping my own gas if I hadn't done that test to see, oh, I have really high levels of that. So get the data so you know where you want to prioritize. Right. And then there's this stuff that I'll call the foundational or platform approach. Your food, ideally you want to eat real food. Michael Pollan said it, right? Eat real food, not too much. So and I always say to people, it should look like itself. If it's been processed beyond belief and you don't recognize it, or you didn't like, if you took the cauliflower and blended it, fine. But when someone else did it, not so much. So to really work on minimally processed, not that much sugar, minimal alcohol, that's the food, right? Mostly vegetables, some protein if you eat protein, and minimal carbs. Food. Sleep. If you don't sleep, you won't detox. You can't detox your brain unless you sleep. The cells actually, it's really cool. The cells sort of shrink down as you sleep. So there's more space for the brain to drain the toxins. It's really cool. So you have to sleep. You have to move your body, sweat. Sweat will cause you to get rid of toxins, move the lymph, move the body. Okay. And then don't be a stress ball. Because if you're someone who's constantly worrying, actively worrying about things, you'll shut your detox down, because detox isn't the behavior you do when you're running from the lion. It's the behavior you do when you've survived the lion. Okay. When you're in fight, flight, or freeze, or your fear, you're going to focus on survival. Survival is not a detox behavior. Okay. So detox is really what you do when your body starts to feel like it's thriving. So that's why you have to take care of the platform of it. And yes, of course, supplementation. If you know you're someone who has MTHFR mutation like me, you would take high dose activated B vitamins so that you can methylate, because you methylate all day long, every day, every second, every nanosecond. So you want to optimize the body so it can perform. And then you want to target the treatment for what the problem is. So if it's heavy metals, you're going to do liver support, binders, replacement. If it's mycotoxins, it's binders and sweating. And if it's environmental toxins, it's glutathione, NAC, B vitamins, phase 2 support. You're going to do, it's different depending on what category of toxins you have. So you target it.
Right. So if people had to eliminate stuff completely from their lifestyle, so not just once in a while, but like completely. I'm thinking nail polish and hair dye. I'm not happy about it, but what would your advice be?
So I say you can't walk a mile in anyone else's shoes. And so you want to really prioritize for you, what's that thing that you know is not in your best interest? So for some people, and now a bed, the beds with the flame retardant is a huge source of exposure for people. So if you're in the market for a new bed, that would be what I would prioritize, is level up on the bed so you get a bed that doesn't have flame retardants in it. It really, you have to target the treatment to what people have. The low-hanging fruit, yeah, when I got that report and I was high for those nail polish, I was heartbroken. I am a surgeon. I have precise hands. They don't shake. Every Monday, I had a new color, a new design. I really took pride. I did my own nails, drove my husband nuts, because I did my nails and then would sit with my hands outside the covers and lie down like a zombie at night, and then try not to move for an hour or two. Drove him nuts. He's like, we can't snuggle. I'm like, no, I have to dry my nails. So that was really kind of sad for me to not do that any longer. But on the other hand, don't fill the pump, right? So that was something I prioritized because it was a low-hanging fruit. I never dyed my hair, so I didn't have to emotionally wean off of that. But I'll tell you, man, weaning off nail polish was hard. And I reserve the right, if someone gets married, that I'll put nail polish on, right? Like, this isn't perfection. This is just try not to fill the pump most of the time, but it's not about perfection. Okay. So for some people, it's going to be, and the other thing is with mycotoxins, if you're being exposed actively to mycotoxins in your home, that would be a huge priority. So often people who have water damaged buildings or a very wet basement, those are really big priorities, because those are pro-cancer causing, and those are immune suppressing, and those are going to really make you sick. So you have to prioritize whatever that thing is that you can handle and that's most important that you're being exposed to.
So how does somebody just detox? You hear about charcoal and you hear about this and you hear about that and chelation, but how do a person detox?
We do all of those in our practice. And what I would say is no woman is an island. Don't do this alone. Work with a functional medicine provider, get the data, get a plan, get a sustainable plan, right? Because detox is not for the faint of heart. It's a lot of work. I started my process in April of 2019, and we are coming up on 3 years. It's hard work. And you can do it successively or you can do it all at once, but it is something that requires a lot of thought. So yes, all of the above: chelation, binders, activated charcoal. We use Welchol, which is a cholesterol agent, actually, kind of randomly. It's terrible it doesn't work to bring your cholesterol down, but it's great for ochratoxin. So we use it. Sauna therapy, infrared biomats, magnetic therapy, all of PEMF, all of these things are ways to move the toxins. And so it really depends. It's targeted. Some of it, we have to target the treatment for what can people handle. I'm hardcore. I was like, I'm just doing all of it. Okay, well, that's an awful approach if you're overwhelmed, right?
Right.
And if you don't have any family support, like I have a lot of family support. I come home, I do something, and they know I need 10 minutes before I can eat because I got to wait. I just took my thing. So you really need to design the treatment in a way that's going to work for you. Only one size fits you. So we have protocols, but I always say to someone, like, you're a sensitive soul. I'm totally tweaking your protocol because what fits that person is not going to fit you. You're going to be sick. And the goal is not sick. The goal is better.
Right. So it's like PEMF. When we tell somebody to start PEMF, high intensity PEMF, you gotta build yourself up to it. You're not gonna go all in and go 100% the very first day. You're gonna have to get and then while the detox process happens with the PEMF or the detox program, people have symptoms and they might end up feeling worse one day, and they will be like, it is that PEMF that did it, or the stuff that you gave him that did it. But you gotta kind of, each person is an individual effort.
Yeah, you have to honor what the body needs. And so
I like that.
In retrospect, I'm like the worst patient, right? I'm like, I'll go hardcore into everything. There's a reason it says take a quarter of a chlorella tab. You can react. I was like, well, okay, whatever. I took 2 tabs. Bad patient, bad doctor, right? Bad doctor. And I had a react. I was like, I'm having lots of hot flashes. So you can have reactions. Go slowly.
Again, I was doing juicing years ago, and I decided I was going to do the liver detox, and I was juicing beets. They say just do a little beet and mix it with something. No, I did a whole beet and drank the whole glass, and then I passed it on the floor.
Oh, you're my soul sister.
Right? Hardcore.
Yep.
There is no going in easily. No,
but I say to people, I made all the mistakes, so you don't have to. Don't do what I did. Your doctor's a very bad patient. Do not do what I did. Do what works for you.
Right.
Be nice to yourself.
Be nice to yourself. So if you had to say to somebody, if they had to choose one thing to do differently that can help themselves as well as the environment, what would you say?
Well, I have to make some presumptions here, right? I have to qualify that. So I can't commit. I only committed for 50 years in marriage. I could not commit for life. I was like, I can't. So I have a commitment issue. So assuming that you've dealt and addressed the platform, your food is optimized, you don't drink alcohol, you don't eat sugar, you sleep well, you do something to move your body and move the lymph, and you're not a stress ball, right? The platform. Assuming you've done the platform, then probably the most impactful would be to understand where are you most getting exposed. And then, but when you're adding in that layer of what's the best for the environment, my vote is get rid of plastics, stop using plastics, don't buy plastics. Try to eliminate plastics from actually, I changed my mind. Single-use plastic water bottles, Poland Spring, because they're endocrine disrupting, they never degrade. So they're bad for you. They're bad for the environment. That would be the one thing that I would say, don't do that. And then you come back and say, well, we've already done that. Then I go, okay, get rid of all the plastic in your house.
Right.
Okay. For example, we use parchment paper to put on top, I'll make a lasagna and then like, wait, I got to cover it. I don't want to put plastic on that. Parchment paper, because it's not leaching. No, some of the aluminum foil sometimes will leach. So parchment paper, and then we cover it with aluminum just so that because parchment paper doesn't crease. It's very annoying. So I would say get rid of plastics in your environment. Try not to use saran wrap, plastic bags. Do your best. I have kids who have lost all of their bags, those reusable bags. So I was like, okay, I've lost that war, right? I've lost the war. Right. So do your best, right? You can't, perfection is not going to happen. Just do your best. Pick your battles. That's not a battle I picked. I picked the battle of, we're not going to microwave our food. And there's no plastic. We're not storing our food in plastic. That's the one I picked.
See, I like that, because I think when you think about plastic, you think about how many things actually are in plastic. And if you can just eliminate it, I think that's a good one lifestyle thing. So
I was just listening this morning, Marlene, to a report on NPR, and it said that they were talking about how all of this plastic gets shipped to other countries, and then those other countries have to deal with it. It's part of the recycling program, except 1 ton of plastic burning creates 2.5 tons of toxic gases. And I was like, well, that ratio doesn't seem very good. If you think about it. So the plastic, in trying to get rid of it, we're creating an even bigger problem. So I would say plastic.
Right. Put and I think if we all did our part and each person chose that as their little lifestyle change, I think we'll be good to go.
Yeah.
This was actually quite enjoyable.
You're surprised.
I didn't really know what to expect, and on toxins, and I'm a germaphobe, so anything talking about toxins and dirty, anything kind of makes me a little weird. So this was good. This actually was a good dirty.
You.
So thank you so much, Wendie. Thank you so much. And tell Ed his book is in the mail.
I will. Thank you so much, Marlene. This is great.
You are so welcome. So welcome. Thank you.
Thanks for joining me on the PEMF Effect. I hope today's conversation gave you new tools, insights, and inspiration to take control of your health. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who could benefit from PEMF therapy and holistic healing. Your body has the power to repair, recover, and thrive. Sometimes it just needs the right charge. Until next time, stay curious, stay proactive, and keep powering up to better health.